everyone. Welcome back to Flutter channel, where you can access the latest US news. Let's talk about Andrew Yang. Yang said his plan on healthcare.
Mr. Yang, I want to bring you in. You support a Medicare for all system. How do you respond to Governor Inslee?
Well, I just want to share a story. When I told my wife I was running for president, you know the first question she asked me? What are we going to do about our health care? That's a true story, and it's not just us. Democrats are talking about health care in the wrong way. As someone who's run a business, I can tell you flat out our current health care system makes it harder to hire. It makes it harder to treat people well and give them benefits and treat them as full-time employees. It makes it harder to switch jobs, as Senator Harris just said, and it's certainly a lot harder to start a business. If we say, look, we're going to get health care off the backs of businesses and families, then watch American entrepreneurship recover and bloom. That's the argument we should be making to the American people.
Thank you, Mr. Yang.
In my book, it's like I was a little bit ambiguous in terms of those two things as well. But I've come to believe that that a public option would be better and also would enable a better transition. And the goal is to make it, frankly, such that most private insurance has no place in the market and that you get rid of it. With the save for perhaps a few super gold-plated concierge things that might not be a bad thing for the American people, because if some really rich people are spending lots of money on esoteric treatments, then we can benefit from that research and the money. So at this point, the plan that I saw that I've now gotten on board with has been bringing down the Medicare eligibility age over time as a phased rollout, and then make it so that all Americans become eligible for that. Try and get the prices down and the access up, and then essentially squeeze out the private insurers out of the marketplace and demonstrate. Because most consumers, if you tell me, hey, I've got this low cost quality public option, I'm going to embrace that. I'm going to jump on that, and you can make that happen, I think, much more expediently than if you were to make private insurance illegal.
So you actually do want to make public insurance illegal. That's the long-term goal.
I want to make it so that private insurance is irrelevant for 95% plus of Americans, that we're all perfectly happy showing up to our medical healthcare provider and saying, hey, I'm Andrew, I'm here, I've got the plan everyone has.
Right.
And my parents actually have experienced this. They were blown away. My parents are immigrants from Taiwan, and they've been living in Taiwan for the last number of years. And they've been blown away by the disparities between that healthcare system, where they just show up, they get what they need done, they pay $20 out of pocket, and then they go home and are like, that was it? Like, I didn't have any crazy forms or like third party and none of that. And they come back to the U.S. and then all of a sudden it's back into the maze, the high cost maze.
Thanks for listening. Please subscribe our channel to update the latest news in America.